Hi, my name is Alec Lee, and I'm the director for our Latin America healthcare practice at FrontierView. Today, I'll bring you some key insights from our recently produced report, Latin America Healthcare Events to Watch. Our Latin America Events to Watch report is an update of our key events to watch for the region's healthcare systems. In this iteration, we bring to you new key events for 2021, looking at ongoing developments from Colombia's ability to address its acuerdo de punto final in the contributive social security regime to Brazil's ANS's contemplation of a new process for updates to the private sector formulary. Within the 9 disruptive events to watch that we've identified for Latin America's healthcare systems in 2021, we see 2 overarching themes. The first is related to a movement towards fundamental reform of healthcare systems within the region. We see legislation being concentrated on in Colombia to modify the role of the EPSs. We see the government in Chile moving the FONASA reform and the public sector reform into the Senate in order for it to be considered together with an ASAPRE reform. And we see the government in Panama considering a combination or a consolidation of its key social security payer along with its Ministry of Health. In addition to that, there are rumors of deeper reform measures being proposed in places like Brazil, as well as Argentina, where the Vice President Cristina Kirchner has recently been discussing the consolidation of the obras sociales. The second theme is related to a movement towards redefining how value is determined within these healthcare systems. This means that we're seeing governments across the region reevaluate the role for their HTAs, their health technology assessment organizations, in making decisions for inclusions and exclusions from formularies. This makes sense considering the impact from the pandemic on budgets, as well as an acceleration of an attempt to improve equitable access across populations. Now, we're seeing this take place in Brazil, where the country's private sector regulator, ANS, is reconsidering the process for updating the private sector formulary and including potentially the public sector HTA, CONETECI, in the process for prioritizing new submissions. We're also seeing this conversation around value definition and the role for the HTA in Colombia in relationship with the always developing maximum budgets, the presupuestos máximos, as well as in Chile, where within the reform proposed by the government, in the process of understanding the implications of this reform in the Senate Commission on Health, there's been a proposal to include an HTA within this legislation. Finally, we also see an ongoing debate on the role of the newly formed RENATA in Peru and potential impacts for access and reimbursement coming in 2021 and 2022. With that said, within this report, you will find analysis of each of the key events to watch for Latin America's healthcare systems in 2021, including top developments to date, a probability that we've assigned to the event coming to fruition, and finally, a timeline to track to understand how the event is developing across 2021. I hope you found this video insightful, and we look forward to supporting your team and its strategic initiatives across the coming year. Thank you.